Go.
Today we're going to demonstrate fixture level impression technique for the Dentsply implant system. We will talk about both the closed tray and the open tray technique. The technique you choose is really practitioner dependent, the closed tray being slightly simpler, theoretically the open tray being slightly more accurate. The initial step will be to remove the healing cap, which will be on the implant. It's not present on the model we have tonight. Once the healing cap is removed, you should not drag your feet to take the impression, as the tissue actually will begin to collapse within a couple of minutes. It is important to know that before I turn the patient loose to you to take the impression, I will have checked the stability of the implant with the ISQ Astra, and we'll make sure that it's ready for you to take the impression, so you should not have to worry about instability or discomfort. So the closed tray component looks like this, and it's a simple matter to, once you have the implant identified, you simply drop it into the implant and just move it around slightly, and the system actually will go in just one way and it will seat itself. Once it's seated, you just hand tighten the knob. Once it's hand tightened, you're ready to take your impression. You seat the impression tray in the patient's mouth. Once it's set to completion, you remove the impression tray. The closed tray component will stay in the patient's mouth. You then will remove the component, and prior to putting it back in the impression tray, you're going to want to replace the healing cap so that the tissue doesn't begin to collapse into the site. Once you've done that, then you can take your impression component and seat it into the impression. It will only go in one way, therefore it should be very accurate, and then you can turn it to the lab and they can place their analog. So that's the closed tray technique. The open tray technique is simple, slightly more complicated. With the open tray technique, it is necessary to modify your impression tray by making a hole into the tray that the component will protrude through. So once you have the tray modified to your satisfaction, and only once you have it modified, you can remove the healing cap. Once the healing cap is removed, you can seat your impression coping, and again, it's very nice. This will only seat one way, and you initially hand tighten it with the knob at the top, and then take your screwdriver and finger tighten it so that it's secure. Once you have that done, you're ready to take your impression. I would advise over the opening that you've made in your tray, placing some beeswax to contain the impression material. As you seat your impression, then the component will pop through the beeswax in the hole in the tray. Once it's set to completion, then and only then do you unscrew the component. Just unscrew it so that you know it's loose, and then as you pull your impression, the coping actually will pull in the tray. And once you make sure that there's very few voids around it, then you can send it to your lab and they can attach the analog. Then somewhat expeditiously you want to replace the healing cap to make sure the tissue doesn't begin to collapse. As far as open versus closed tray, that's certainly practitioner dependent, and preference is really all that matters. My personal preference would be for single units, certainly closed tray is sufficient. For multiple units, open tray may be slightly more accurate, just for your information.